I'm Anna Lippard, Health Director for Jackson County, and today I'm going to talk about our local preparedness and response efforts to the recent measles outbreak. Our team started preparing for measles long before there was even cases in North Carolina. So several months before, we had a tabletop exercise with our community partners, but then later on we began working on our preparedness plans, reviewing and updating any forms and communication materials, and then also started an educational campaign with the public about checking their vaccination status and encouraging folks to get the vaccine if they needed to. If we get a suspected case of measles, our public health response begins immediately. After consulting with Epi on Call at the state, our communicable disease nurse would then reach out to the provider and ensure that the patient is isolating appropriately and getting tested right away. After that, we then begin assessing where the patient may have been while they were in their infectious period. So understanding where they traveled, where they had been around, so we can identify any potentially exposed individuals. But also at the same time, we are communicating with any community partners that might be affected, and also making sure that we are sharing and being very transparent with information with the public so that they understand the risk that might be imposed on them. So then we begin contact tracing. And that's the way I like to think about that, is all hands on deck. So this could be anyone in the health department staff that steps up to help during contact tracing. And that's where we're really identifying any individuals that might have been in some of those locations with the potential measles case. And then that way we can assess their risk, their vaccination status, and make sure that they have information to keep from spreading the disease. When I think back about the measles response, the partner I tend to think about is EMS. EMS is one of those partners that is always there for us when we need them. Now, you may not think that they're a key partner for public health, but no matter the situation, our EMS friends are always helping us out. They were part of the tabletop exercise that we had held. They were part of our EPI team where we gathered and we really nailed down kind of what our procedures were going to be during our response. They even helped us come up with some triage protocols for dealing with incoming potential patients that might be infected with measles, and working that too with 911, so that in order to protect the patients and the first responders. One of the challenging experiences during this response would probably be that we were battling a couple of different priorities at the same time. So we weren't only just monitoring measles and the potential incoming measles to Jackson County, we also at the same time had back-to-back winter storms, and we were having discussions on the possibility of having to open emergency shelters. And so that for us, that, you know, we're thinking about not just those things in isolation, but how they are working together, because we don't want to bring measles into an emergency shelter or any other infectious disease. A story that stands out to me in our preparedness response here in Jackson County was when we got our first suspected case that was associated with the local school system. It turned from measles being something that was happening elsewhere to possibly being something that was here in our community. And we were able to respond in a way that was quick, and to know that all the planning and preparing for that moment had paid off, and we were ready to respond quickly. Fortunately, that case was ruled out, but had it been a positive measles case, it would have prompted an immediate response. So we would have pulled together with the school system as well as our emergency management partners to ensure that we were responding quickly to this event. There could have been some serious disruptions in the classroom. So we would have had to know where all that student had been, who was potential exposures during their infectious period, and make sure that folks were quarantined and isolating appropriately. So So all of the different response efforts that we're required to do in the case of a measles exposure are all designed to keep our community safe and prevent the spread of measles or any other disease that we might be looking at. So one misstep in our response efforts could lead to potential exposure of hundreds of students and staff in a school system. So it's important for folks to know that measles is highly contagious. For me, I think I understood that we were making an impact on our community when we started to see our educational campaigns make a difference in the fact that people were calling and checking their vaccine status, and then also coming in and getting vaccines, either getting the initial vaccine or possibly getting updated on their vaccine. So a big part of our community outreach and education was having folks check their vaccine status and then encouraging them to get that vaccine if they so needed it. So it was really cool to see folks coming in and checking their status and getting those vaccines after all the education we had done. We started to notice that folks were coming in to get their vaccine status checked and then getting the vaccine if they needed it. So we understood that our message was not only educating people, but also prompting action. I think for me as a public health worker, and I don't want to speak for other public health workers, but we do this because we care. We care about our community. We know that this work is important. We don't often get any recognition for the work that we're doing. We work behind the scenes to keep our communities healthy, but we all deserve to be healthy and be as healthy as we can be. And so that's what keeps me showing up, is making sure that I'm here putting my best foot forward for not just my family and friends, but our entire community. So we know public health is working when we don't see it. So when our kids are still in school, when parents can still go to work, when we're still out in the community doing the things that we enjoy doing freely, then that's when we know it's working. When people are living their lives, doing normal day-to-day things,